The next skill we're going to do is the parenteral administration. This is where you're given medication through an IM, intramuscular injection, ID, intradermal injection, or a sub-Q or subcutaneous injection. And before we actually go through the checklist that I know you've probably got in front of you, I want to just take and split off and do how to draw up from a vial, how to draw up from an ampule to start with, how to mix your insulins, and how to reconstitute medicines, and how to draw up from an ampule in a vial in the same syringe. So the first thing that we're going to do here is take your ampule, and the difference between an ampule is you do not inject air into it. But the other thing is you need to clean the neck piece off here. So I have an alcohol prep that I'm just going to clean off here. Okay. And then you want to take another alcohol prep completely enclosed, and you want to make sure you've got all your medication down out of the neck of the bottle. If some of them is in the neck, you can either shake it down, you can thump it down, or you can just shake it this way. Don't draw up if you've got your medicine up in the neck of the bottle though, because you'll lose a lot of it. Now, take the alcohol prep, see how my hand covers it so I don't cut my thumb, and quickly snap it away from you. Take the whole alcohol prep, because it may have slivers of glass, drop it in the sharps. Okay. Now, what you want to do with this is we have to use a filtered needle. The filtered needle just has cotton in the end of it that stops the glass from being drawn up into the syringe. So we'll open this up, put the filtered needle on. Okay. Now, with this right here, I can touch the barrel of the syringe, but I should not be touching inside this plunger here. It's a new syringe, so what you want to do is work it back and forth so it'll lubricate it, make it easier for you to draw up. Okay. Now, we're just going to say that we're going to drop 1 milliliter of this. Okay, you can take and actually put your needle in with the setting right on the desk. You can hold it up to draw it out. You can hold it down. It doesn't matter, just so you don't put any air into it. Okay, go ahead and we're going to pull up 1 milliliter. And notice I've got the numbers where I can actually see what I'm pulling up. So I'm going to pull up to like 1.1 milliliter, about 1/10 of a milliliter more than what I need. And what I want to do now is step back and flick the bubbles out, because you're probably going to have a bubble there. You'll be at a zinc where you can actually hold it over the zinc and actually shoot the excess out till you have 1 milliliter. Okay, now what you want to do, and it's best when you first start off, just to recap with it laying down, and you can put your hand on it like that once it actually starts into the cap and push it on. Okay, what I want to do now is actually open this up, and this is my regular needle part here. Take off the filter and put on the regular needle, and now I'm ready to go. Okay? So it's best to label your syringes with what you have in it, and I'm going to label this one. And then you don't want to put it up around your medication, because if you're given an injection, you'll want to be able to aspirate if it's an IM, which obviously this is a 1.5 inch needle, and we'll talk about that in a little bit. So I'm going to put it here on the cap that should stay on it right here. So this medication will be to the side, and this was where we actually drew up with the ampule. Okay, now we only use an ampule once, by the way, so I'm going to go ahead and put this in my sharps container. Okay, and we're going to get rid of our filtered needle. That goes in the sharps. Okay, the next thing I want to show you is how to draw up from a vial. Okay. And when we draw up from a vial, what you're going to do, this one is sterile, so technically you don't have to wipe the top off, but it's probably a good idea to get into the habit of wiping the tops off, even if you pop the sterile lid off of it there. Because see, if I don't touch that, nothing else has touched it. But out of habit, you'll see me pop them and still wipe it. Now with this one, I'm going to open up, and these happen to be apart, and sometimes your hospital may get these that are apart like that, and you actually have to put them together. With this one, we've wiped it off, okay? And you can let the alcohol dry some on that. Again, a new syringe, so I'm going to work the plunger, just touching the flange here, not the actual round barrel part that goes inside, the plunger that goes inside the barrel. Okay, we're going to pull up 1 milliliter here. Okay, so I've pulled up 1 milliliter of air because I'm dealing with a vial. Okay. And again, you want to take and put it in the center, push it in. Now, this is where I can see the tip of the needle through the bottle. You should put air to air. If you put air into the solution and it's a small amount of solution, you get a lot of bubbles. And if you do that, then it's going to take you forever dumping them out. So I'm going to pull back and put air to air, flip it up. And now this is where you want to look and find where there's no label. And make sure the tip of your needle is down in the solution. Otherwise, you're going to keep pulling up air. So I'm going to pull it down a little bit. I'm holding it here. And again, I always have the numbers facing me so I can see what I'm getting there. Now I'm going to pull down to 1 milliliter. All right, and again, I'm going to check it. There's no bubbles. I'm going to hold it to the side and actually cap it. And again, I'm going to take, and usually I just carry the tape in my pocket here. I've just laid it on the table. It's best for you to get alcohol preps and tape and always put them in your pocket. You always need them. Okay. I'm going to label it again and then label it here, because I wouldn't want to put it back here where when I was aspirating back I couldn't see my medication or how fast I was pushing it in. Okay, there. Now, what you basically have done is you've drawn up from a vial and an ampule. Vial here, ampule. The only difference is don't put air in an ampule, you put air in a vial. Okay? Now, the next thing I'd like to do is to take and draw up what we call a reconstituted vial. The powdered vial that you have, if you will look at it, and it's called Practi powder, and this is where we've got powder and we have to mix the solution up ourselves and we get it. If you look on the back, it talks about 300 milligrams per milliliter, then you need to add the 9.6. What that means, if you look back here on your syringe, if I'm going to give a dose that's, say, maybe a 500 milligram dose, you've got 3 options back there to choose. The easiest constitution that I can see here would have me doing 500 milligrams per milliliter, then I would need to draw up 5.6 milliliters of normal saline. And always read what your diluent should be. It should tell you. Okay, so if I draw up 5.6 milliliters of the diluent here and mix it with my powder, then every time I pull out 1 milliliter from out of this bottle after I mix it, it's going to be 500 milligrams. So that's what we're going to do right now. Let me show you how to do that. Which, by the way, these multi-dose vials you need to mark. They're usually good for 30 days. So I'm going to go ahead and mark the date that I open it, which is today. So that means September the 16th. If this has not been all used up, we toss it. All right. Now, this is reconstituting. You'll hear us refer to it as reconstituting. And I'm going to draw up 5.6 because it tells me that on the back of the vial. So that means I'm going to have to pull up, and again, work your plunger. This is a new, all of these are new syringes, which obviously is what you'll be using. 5.6. Now, again, inject it into the center, ear to ear, and then flip it up. And I want to make sure my needle is down in solution. And as you notice, some of it just automatically flowing into my syringe, which is great. But you displace the fluid with the amount of air. Let me back up. You displace the air with the amount of fluid you're going to pull. So now I need to get 5.6. Okay. And always double check and make sure you got the right thing there. Okay. And again. Now I'm going to pop this, and we should use a clean alcohol prep for each one of these. Okay, with this right here, lots of times there's so much pressure, pull your needle back out of the solution, because watch when I let loose at the plunger. See it shoot back up, the amount of pressure? Okay. Let it come all the way back up, and then you can pull this out, recap it, and just let it lay here for just a minute, because what I'm going to do now is gently agitate it. When we get to insulin, you're going to learn you cannot shake it. You have to roll insulin. But this, as long as you don't do vigorous shaking, you just do a gentle roll back and forth, you're going to be okay. And if you notice in the bottom, it's already diluted down for me. I don't see any, so I'm just going to shake it just a little bit more just to make sure. Okay. So it's all diluted. So now what you would do is just look at your MAR, and if the MAR said 500 milligrams, say 3 times a day, all you would do is pull out 1 milliliter. Okay. So that's reconstituting. All right. And I'll go ahead and pull it up just to show you here. Pull up with this, and we can use the same syringe, by the way, it's still sterile. 1 milliliter to equal to 500 milligrams. Now, I'm in solution. Remember, you want that needle tip in solution, so pull down. And I see better holding it towards the light if you wonder why I keep turning. And pull it out. Make sure there's no air bubbles. And then if we were going to give this one, we would also be marking. You see all these things I'm adding on here and why I'm marking them off. Okay. So this one was with reconstitution is what we were doing. And by the way, some folks will stick it back in their wrapper and label it. I'm always afraid my wrapper will get discarded and then I'll still wind up with syringes. I don't know what they are. All right, now, the next thing I want to do is to actually draw up a vial and an ampule in one syringe. And what I've got here, this is going to be my Finnegan, okay? And I'm going to say I need 25 milligrams of that, which really, if I looked at my MAR, that's what I'm going to have on my MAR too, a little bit later. This, I'm going to say, is my Demerol, and it's going to be 50 milligrams per milliliter. And if you notice, I have expiration dates, so we're okay on those, okay? So let's go ahead and do that. We'll have all our drawing up done before we actually start on the medications. Okay. We've got our syringe, and we know that since we're going to give 1 of the Demerol, the 50 milligrams, 25 milligrams of the Finnegan, which what we've got here is 50 milligrams per milliliter on our label, but we're only going to give 25, so that would be a half a milliliter. Okay? So I'm going to give 1 milliliter or 50 milligrams of Demerol. I'm going to give 25 milligrams of Finnegan or half a milliliter. Okay? So I've done my calculations before I even start. Now, the thing to keep in mind is that an ampule is only used 1 time, and then we throw it in the sharps. The multi-dose vial, which could be a single dose or a multi-dose vial, and we're going to say it's a multi-dose vial of the Demerol, is used multiple times, but we have to mark it. So what we want to do is draw up the one we're going to throw away, and draw up this one here also. The first one we would draw up would be the multi-dose vial, because I don't want to contaminate. Once I get through with the multi-dose vial, then I go to the single-dose vial. Okay? All right, again, I've got my filtered needle because I'm dealing with an ampule. And I have an extra needle there to change it out in just a moment. Okay? So we'll go ahead and put our filtered needle on. And again, we've got to wipe the neck of the ampule. It could get dusty, is the reason why I say that, wherever it's been stored. And now I want to make sure that all my medication down, wrap it with the whole alcohol prep, and snap, and it goes in the sharps container. Okay. Now, this is where, again, a new syringe, so let's lubricate it well. Okay. Now, even though we're going to draw that one up last and I put the filtered needle on, it's perfectly all right to do that, and probably better instead of us changing back and forth so much. So what I'm going to do is draw from my multi-dose vial now. Okay? So I need 1 milliliter, because if you remember right, it's 50 milligrams per 1 milliliter, and I need to get the 50 of the Demerol. Okay? Ear to ear, flip it up, make sure my needle's in solution. and then I've turned it towards me, and I'm going to draw up 1 milliliter. Now, I can draw it down, remember I was telling you to draw it down to like 1.1 or 1.2? I can do that because I don't have anything else in the syringe but the Demerol. Now I'm going to shoot it back out till I get to the 1. Okay, pull it out. Now this one over here, I don't need to put air in, and I don't need to do anything other than to actually go in. And now this is where you have to be extremely careful, because if I drop 1.6, 1.7, my mixture is all wrong, and I'd have to throw it all away and start over. So I only want to drop a half a milliliter because I'm giving 25 milligrams of phenergan. Remember, there was 50 milligrams per 1 milliliter. Okay, I'm going to go ahead and pull up, and it's important to keep the needle in the syringe in solution here so you don't get any air bubbles. Okay, now it looks pretty good. Okay, I'm going to go ahead and recap this. Check again to make sure I don't have any air bubbles. It looks good. So I've got 1 milliliter or 50 milligrams of Demerol. I've got a half a milliliter of phenergan, though there was 50 milligrams per 1 milliliter. Now, I need to take my filtered needle off, and we'll just throw it in the sharps container because it's got glass hanging, possibly glass hanging on the other side. Here's our grit needle here that we'll put on. Okay? So now we're ready to go. I'm going to label this one too, because this one's got Demerol and phenergan in it. Okay? All right. So now, just to recap what we've done, and this goes in the sharps, because we don't reuse that again. This we would label, and we could reuse it again for 30 days. All right. What you've seen is we drew up from an ampule and we drew up from a vial. The ampule, you don't put any air in. The vial, however much solution you're drawing out, you put that same amount of air in. When we're mixing it, the ampule and the vial, mixing those together, you want to draw from the multi-dose vial first and then from the ampule last. And the reconstitution is most important to read what's on the back of here to figure out how you're going to reconstitute it. Now, if this is a multi-dose vial, you would have, most of the time what we do is circle. You can write it out or circle the concentration that we actually have there and put the date that we actually reconstituted it. And then most of the time, 90% of the time, the med has to stay in the refrigerator. Okay? All right, so that's done there. So let me just tidy up here a little bit. Now, the next thing we need to do, we're not through yet, believe it or not, drawing up stuff. The next thing we're going to draw is when we're actually drawing up for an intradermal. With an intradermal, usually the things you're going to give there is going to be the PPD. Probably all of you had it when you came in. This one is drawn up just like a regular vial. And this time I'm going to get my MAR, and we're going to look at that and go with that. Okay, with the MAR, I check the patient's name, I check the allergies, aspirin and penicillin, and I do have an order for PPD, and if I look here, it says PPD, and it also says it's been diluted, and that 0.1 milliliter equals up to 5 TUs, the units that we'll need. And my order reads PPD, 0.1 milliliter ID, intradermal, and it's got before discharge to the nursing center there. So what I would do is I did my check when I pulled it out. I've done a second check to make sure I've got what I need. And now, this technically is the same thing as a vial. The only difference is I'm starting to look at my MAR now. So we swap that off. With this one, what you want to do, again, is work the plunger because it's very stiff. Pull back to 0.1, not 1, 0.1. We've swapped. Go ahead and inject. And remember, you want to stay ear to ear and then flip up, and you want to make sure your needle's in solution, and then draw out 0.1. These lines are really, really small, so pull down to about 0.2, flick your bubbles out, and then shoot back up to the 0.1. All right. Now, I would do my third check since I've actually drawn it up now. PPD, 0.1 milliliters, due at 8:30. It's on Mrs. Mary Johnson, and I'm given 0.1, and it's 5 TUs. Again, this is a multi-dose vial that I drew from, so that one would also need to be labeled, and we would use that for 30 days before we got rid of it. And again, even though my top is red, I still like to mark my syringes so I know what I've got here. So we've done our third check with that, and we would actually be ready to go down to the room to actually give that. So that's the intradermal. Now, we have one more we've got to do, and then we'll be ready to start with the actual medication administration record. This is your insulin. We have regular insulin, which is the short-acting. We have the NPH insulin, or the N insulin, which is the long-acting, the intermittent-acting insulin. If you notice, the long-acting intermittent is cloudy. The clear is your short-acting or your R. Most important that when we're giving those, we think about, can we actually mix those? Like with the Finnegan and the Demerol, can we actually mix those in the same syringe? If you don't know, you always call your pharmacy to get a clearance on it. Now, as it turns out, I do know we can mix these. So with this one here, if you wind up with a patient that has an order, and the MAR that I have has an order for insulin. It looks like it's on Mrs. Johnson again. Aspirin and penicillins are allergies. And looks like she's going to get NPH insulin, and she's going to get 12 units. And then she's going to get it mixed with regular insulin, and it looks like we're going to take and actually give her 4 units. Okay? So we have NPH in 12 units, and then regular insulin 4 units. And we're supposed to give it sub-Q, and we give it every AM. Okay? So now what I need to do is come over here and clean both tops off. Okay. Now, if we take and draw up, let me back up for just a second. I shook it a little bit, but I don't think I rolled it enough. Let me roll the NPH while we're standing here talking. If you take and get ready to give these, what you want to do, you want to inject your ear into the long-acting, the NPH first. So I would inject 12 units into the NPH. And just gently look at the bottom to make sure it's all mixed up and it looks good. Okay? I'm going to swab again because my hand probably touched it. Okay? All right. So I'm going to inject 12 units here and the NPH, the long-acting. I'm not going to draw it up though. I'm just going to inject it. The regular insulin is the clear insulin. I'm going to inject 4 units there and then actually draw that up. Okay? So let's go ahead. You can take and do this one of 2 ways. You can pull up 16 units and inject 12 into the NPH and then the other 4. Or if you want to do 12 units and then the 4 units. Okay, so here's our 12. And we've swapped the tops. Going to inject the ear. Not pull it up. Now come back out and draw up 4 more units. This time we're going to inject that into the regular insulin. Don't take your needle out. You want to go ahead and flip your bottle up and actually draw up your 4 units of regular insulin. And here again, if you want to pull down a little bit below the 4, you can, because there's nothing else in syringe with this right now. Okay, so here's my 4 units. I double check it again to make sure I grab the right bottle. Now here, don't push, excuse me, don't push anything into the bottle. You only can aspirate back, and this time I'm already at 4 units, so I need to get 12 more units, which should put me at 16 total units. So make sure you've got it turned the way you can read it, because if you go below that 16 units, then you've got the wrong mixture, and when that happens, you're going to have to toss the whole thing and start over again. Now, the interesting thing about regular insulin and NPH insulin, if you leave it sitting in the syringe for more than 5 minutes, it's going to take and convert this short-acting over to long-acting. That's why you always draw your short-acting up first, so we don't mix any of that long-acting with the short-acting. Okay? So now we're, again, going to mark our syringe, because this time we've got 12 and 4. And basically what you've seen now is you've seen how to draw up from an ampule, you've seen how to draw up from a vial, You've seen how to draw from an ampule in a vial in the same syringe. You've seen how to reconstitute powder with the diluent. You've seen how to draw up your insulins, regular and NPH together. And you've seen how to draw up an intradermal or a sub-Q. In this case, it was PBD, so that would be an intradermal. So those are all the different types of vials and ampules that you would have to learn to draw from. Now, the next part we will take, and I'll start talking about landmarking, so you'll know where to actually give your landmarks.